So I'm going to talk about the types of psychosomatic disorders, and I'll pretty much use the DSM-5. I know some of you might know the DSM-4, but I'll just try to talk about a few of them. One is a somatic symptom disorder. It replaces what used to be called somatization disorder. And it's defined by having at least one somatic symptom. As you have one somatic symptom, which can be pain, it can be fatigue, it can be weakness, it can be breathlessness. But this symptom makes the individual have significant actions or thoughts that result in disruption of everyday life, as opposed to how it used to be called the somatization disorder, where you would look for at least 2 GI symptoms, 1 sexual symptom, and 1 neurological symptom. So this kind of symptom should be present for at least 6 months. Actually, it makes me think that why wasn't the first case a somatic symptom disorder? He had pain for about a whole year, if I got it right. The other one is the illness anxiety disorder. Here we used to call it hypochondriasis. Here an individual has excessive worry or anxiety about a presumed medical illness. Basically, they're preoccupied about having a certain medical illness. An individual may have like a headache, and all of a sudden they think they have a brain tumor. And this should also have been there for at least 6 months for you to come up with such a diagnosis. Another interesting one is the conversion disorder, which is otherwise called the functional neurological symptom disorder. Here an individual presents with either a motor or sensory deficit that is out of proportion from what is expected, and it can be explained by any neurological disorder. Yes, those days in DSM-4 they used to say it is preceded by a stressor. So usually people have a stressor, then they present with these symptoms. You'll see one of the most common ways people with a conversion disorder present is with paralysis. Some of them have pseudo-seizures, maybe that's what we saw there. Another one is the factitious disorder. So basically, this is where an individual falsifies either physical or psychological symptoms in order to assume the sick role. Basically, they will start saying they are having headaches, they will start saying they are feeling depressed, to assume a sick role. They will present like they're either ill or they're impaired or they are injured. But the difference between this and what we call malingering is, for the other one, the individual, there's an external gain. Here there's no external gain. With malingering, people do that because maybe they want money, they want to get a job or something like that. The other one, which was added, is psychological factors affecting other medical conditions. Here an individual already has a medical condition, say cancer, say diabetes, but there are psychological symptoms that are affecting this disorder. They will either affect it in a way that there are those symptoms like coping, for example. So if an individual is in denial, like the coping mechanism is denial, it will affect their disorder in a way that they're not going to take treatment. It's going to affect the prognosis. So basically it will interfere with the treatment and affect them. Another thing is depression, which can also affect these individuals who are having these other medical conditions, and it also affects the prognosis. Another example is like anxiety, which actually sets off the things like asthma. So this disorder has been seen to have a temporary relationship with the medical disorder, in that whenever the individual has that kind of disorder, whenever the individual, say if you're anxious, the asthmatic attack sets in. The others we're going to look at used to be in DSM-5, DSM-4. Like pain disorder has actually been put in somatic symptom disorder. disorder, and they say it's it's a specifier if it's a somatic symptom disorder with pain. The other one that we used to know in DSM-4 is body dysmorphic disorder, where an individual is excessively concerned and preoccupied with a perceived non-existent. It's usually perceived, and they perceive this, but it's actually not there, and physical defects. So the others are the undifferentiated symptom disorder, where an individual has one unexplained physical symptom present for at least 6 months. Thank you very much.